to try this product, and he pulled out the Capillus cap, and I said, well, what is it? He said, it's a cap that's been designed for laser hair therapy. You know, he was a hair loss, he is a hair loss expert, world-renowned. And he said, you should try this. It's working for millions of people, and I believe it could work for you. It can help stop the shedding. It can help start to turn it around. It can start to invigorate those follicles. Anyway, I gave it a go, and now if you ever see Capillus, you'll see a little testimonial of me. I have noticed a difference, as skeptical as I have been, and I get that from my dad, who never believed anything. He didn't believe anything. This is something that I jumped on. I've only ever presented it twice, this being the second time. Because again, normally it's in beauty shows, but this is a product, if you or somebody you love is struggling with hair loss and they don't think that there is a solution, an alternative, I want you to stay with me for the next 20 minutes, because we're gonna talk about an FDA cleared device that is scientifically proven with amazing next generation technology to get the job done. Now, there are many copycats. This is the originator, the innovator. In doctors' offices around the country, it's $2,000. We have an offer today. It's already been on today. This is the final presentation of the day. It's $15.49, so an amazing saving. I wanna be the first to let you know that Capillus and HSN are gonna back this up with a 6-month return policy. We're extending the 30-day return policy to 6 months. That's how confident we are that the Capillus cap can work for you. So let's start from the beginning. If you've noticed when you look in the mirror that you're starting to lose the volume in your hair, the thickness of your hair, if you've started to see a difference in your hair, it's, as I felt, distressing, especially because I'm on TV. It's like, oh my gosh, why is this happening to me? But it's real life, and it happens to many, many, many people. Let's talk to an expert, somebody that travels the world helping to educate and teach with regards hair loss and the amazing techniques available to help counteract it. He is world-renowned, Mr. Barry Pintar. It is a pleasure to see you and welcome you to the show. How are you, my friend?
I'm doing great, Adam. It's terrific to be with you tonight. And you're right, I love talking about this technology because we are talking about a real medical device. As you mentioned, I have in the past sat with thousands of men and women, and it was my job to explain to them if there was anything they could do about hair loss, because they would come in asking that question. Let me give you a perfect example. Let's take a look at Daniel right at the top. Daniel would be a typical guy who would come into my office, and I worked in the largest medical facility in the world specializing in hair loss. Look at that before. Now, let me make it very clear at the top. This guy right here used this exact medical device we're talking about. Daniel would come in freaking out about his hair loss, saying, can we please stop my hair from falling out? I was able to say, Daniel, we have a medical device that you can actually own and use at home for 6 minutes once a day, and we can not only stop your hair from falling out, we can help it to regrow. I mean, look at that after, Adam. That's incredible, because again, as you mentioned, we're talking about a real FDA-cleared medical device that you own and use at home in only 6 minutes a day.
I mean, that is an amazing before and after, and you look closely and you can certainly see the difference in not only the coverage, but the thickness there, right? I mean, it's something that you have to see. I don't want to put our very special guest, Sonia, on the spot, but I do want to ask, because Sonia, do you mind me asking you this? Are you sure? Sonia, it is your boyfriend, husband, I knew she'd got married, I didn't want to misspeak. Sonia, your husband has also been using this, correct? And he's loving the results? You see the results? The back of his head. Okay. You've watched Sonia for many, many years on HSN, and you know Sonia very well. This is a conversation that's been happening with many, many folks. There is the skepticism, there's the excitement, there's the curiosity. Could it work for me? The answer is it can. Absolutely it can. It can work for you, but you have to try it. Now, what HSN's done is break it down into easy payments. So it's an easy payment of $309. You go to a regular store or doctor's office and you pay the full amount. So we're cheaper, we're better value, you get the flex, you get free shipping, and you get a 6-month return policy. I mean, Barry, from the questions of who is this for, how long does this take, what can I expect? You must get those questions all day, every day, right?
Yeah, I do. And the more questions I get, the more I love it, because this is what I do. Now, to answer some of your questions in order, and then we'll go to some animation and I'll show you exactly what's happening, and maybe then we can go to Isabel and we can let you listen to someone who's really used it and seen amazing results. For starters, we're talking about growing real hair. That's important to note here. This is not a cosmetic. This is not something that's going to happen in 1, 2, or even 3 months in terms of you looking in the mirror and seeing amazing results, because we're doing a medical FDA cleared device. So first of all, FDA cleared, right? We're hearing more and more about that and what that means, because during the COVID vaccine, I used to have to spend a lot of time explaining to the men and women I met with what a big deal saying something as FDA cleared is. We get it now because we've watched the press conferences. So FDA cleared means, number one, efficacy or effectiveness. So think about this. The FDA says this technology is effective, meaning it will work. But that's still not enough. You still have to go on and prove through human clinical trial safety. So again, the FDA says this will work and it will do it safely. How is it working? Take a look at this animation. Basically what's happening when you're suffering from hair loss, this is cleared for, FDA cleared for androgenic alopecia, andro, human, genic, you inherit it. Alopecia, the medical term for hair loss. What's happening are the cells are dying in your follicle and the follicles are getting smaller. When the follicle gets smaller, so does the hair get smaller. That's how you see that tiny little peach fuzz on the top of your head. The little hairs that just seem to get smaller and smaller because they are, and eventually they'll die. That's permanent baldness. So what has the medical community advanced to the point where they can do what they can do? They can treat that follicle and actually stop it from dying and bring it back to life, so that not only is the follicle healthy, but the hair is now healthy. And that is exactly what Isabel's story is. She tried for years to find something that was going to help her hair loss. It was thin, she could see her scalp. She was about to give up. Then she heard about an FDA-cleared medical device that she can own and use every day for 6 minutes. And this is what happened.
Guys, we're gonna find Isabel's video. I believe
we don't have it. Okay, my bad.
We're gonna try and get Isabel's video any second for you. Here we go, here we go. Here's Isabel.
Hair probably started when I was about 40. I guess are in denial for a while, and you think, oh, this is just short term, it won't keep going away, and my hair kept going away. I think at first I thought it was gonna be easy to find a remedy. You know, hairdressers recommend different products.
I think for a lot of us, it's the curiosity, but also the nervousness. And that's why I think within the framework of Home Shopping Network, there is a sense of security. If you were out and about with a retailer that maybe you don't really know, you're not certain of their return policy, we might be scared to death to say, okay, I'm gonna plonk down the money to try this. What if you don't like it? What if it doesn't work the way you want it to? HSN is proud to offer this with a 5 flex pay, so it's $309. You don't need to pay the full amount, and you must understand, listen to me carefully, you must understand this. In your whole life, if you were ever going to try it, like I was, you know, that fortunate moment of Barry seeing me in the hallway nearly a year ago, if you were ever going to try it, now is your time, because you have 6 months. So from the minute it arrives, you've got 6 months. If by the end of month 6, you say, I don't like it, I don't love it, I'm not seeing the results, you send it back and you get your money back. Think what I just said. You send it back and you get your money back. But you don't know unless you try it. And if in 6 months it's worked for you, like it's working for Sonia's husband, like it's working for me, like it's working for Isabel, then surely it's worth it. Because at that point, wouldn't you pay any money? You'd pay any price. If I could share with you that this is a proven way, an FDA-cleared device, scientifically shown to help restore thinning hair, help prevent further progression. The before and afters, I mean, Barry, they are compelling to say the least.
Yeah, and what you're looking at right there, so this is, Yvonne, this is a typical female pattern. Ladies at home, I know you see this happening to you. Your parts getting wider and wider. Your bangs are going away. You're receding. Notice how within 12 months, her part is filling in, her bangs are back. That look how much thicker and healthier the sides are, because see, that's what you have to understand. And by the way, she's only halfway home, because it's going to take a full 2 years until you get the maximum benefit. Of course, it's going to take about 6 months until you start to notice it, which is why we give you that 6 months, because we're talking about growing real hair. Real hair. You can cut it, you can color it, you can perm it, whatever you want. This is Lester, and here's why I bring Lester. It's important that you know that, and I say this all the time, if you have a class reunion to go to in 2 months and you want to buy this so you have great hair, do not buy it, because you're not going to have great hair in 2 months. Because again, if you remember what I talked about, you have a follicle that used to be healthy that has shrunk and got smaller and is dying. So we're not doing some kind of cosmetic process to make your hair look thicker. We are actually medically treating that follicle. We're catching it before it dies, and we're bringing it back to its full, healthy life. So you've got to give it time, and you've got to be patient, and it's so simple to use. We can show Sonia again. And by the way, Sonia's husband not only uses this, but Sonia herself uses this. When Sonia was our model, when I first started there, she stopped me in the hallway and said, "Hey, Barry, just so you know, I actually bought this a few months ago." So look, she pops on her head. She's going to push one button. That simple. The lights come on. Now she is doing her treatment. See how that pops off? That pops off because there are computer chips in there that regulate the whole thing. It's all been done for you. 6 minutes later, it's going to turn itself off permanently. Sonia puts that away, takes it back out the next day, and repeats. It's simple as that. And by the way, this cap, the medical magic is really the insert that you can put into any cap. So I took it out of the Capillus cap. I put it into here, and I'm really not wearing this to be funny. I don't know if I look like a fool or if this looks good, but the point is, the magic atom, and magic's really a bad word because it's true medical technology, is this right here. Yes. This is the medical device. Keeping in mind, this is 202 lasers. So this is the professional grade that if you went to your dermatologist, your hair loss specialist, again, I worked in the largest of the world, this is exactly what we offered to our men and women, that all the doctors offer to their patients, because this is a real medical device.
So this launched earlier today at this special offer, and this is the final presentation of the day, so please bear that in mind. We are approaching midnight, the bewitching hour, so if you'd like to order, certainly try and get your order in before midnight. I'm thrilled that Barry was able to share with you that this is the professional grade. This is the over 200 lasers, rather than the 80 to 90 that other lower grade models has. The more lasers that it has, the more it's able to achieve in a shorter amount of time. Barry, take me through, you know, one of the big points to me is that it's 6 minutes a day. It's such a small amount of time that you have to dedicate to this. Talk to me about the schedule, how I'm using this to maximize my results.
Okay, yeah. So again, that's 6 minutes a day. I get questions like, what if I used it twice as much? What if I skip a day? Well, here's what you have to understand. When we say something is FDA cleared, and again, I used to spend a lot of time explaining this stuff, we now understand what it took to get that FDA clearance. So keep in mind, this is not something new or experimental or something we're bringing, gee, this is a great idea. Aside from the fact that the FDA, looking at human clinical trials, is telling you, the American public, that this medical technology is effective and that this medical technology is safe. Since then, there have been hundreds of human clinical trials, thousands of medical papers that prove what this does. Now, it's important for me to say, again, I've sat with thousands of men and women. That was my job in my early days. Now I train the actual doctors who train those people people and their staff. But my job back then, as I take very seriously to this day, is that you understand every single option that's available to you, and here's why. This is my passion. The fact that you can do something about hair loss now is huge. So I really want you to understand every single thing you can do, because here's what's up. Some people think there are zero things. There's nothing I can do, I'm just going to lose my hair. Not true. Some people think there are hundreds of things, I just haven't Googled enough to find the right one. Not true. So let me make this perfectly clear, because it's important to understand, getting specific to Adam's question. Men, there are only 4 things that the medical community recognizes that you can do. Ladies, there are only 3 things that the medical community recognizes you can do. Let me run through them real quickly. Number 1 is minoxidil. That's a topical that you put on and leave on twice a day. You must put it on and leave it on twice a day, or it will not work. Almost every infomercial that you see out there these days when they're talking about putting something on your head in topical form, it's minoxidil. They just don't want to say that because there's been a problem with compliance, meaning people start it and stop it and don't follow through with it. The second one is, and that's for men or women. The second one is Finasteride. That's for men only. Finasteride was originally, and still is actually, a prescription for an enlarged prostate in a male. They found it had the pleasant side effect of helping to stop hair loss, so they repackaged it, rebranded it, called it Finasteride. It can have side effects, sexual side effects of low sperm count, lack of libido. Third one, for men, that's for men only, by the way. Third one, PRP, platelet-rich plasma, where you go to the doctor's office for the rest of your life and get shots in your scalp. I can tell you that in 3 or 4 months of just going to that one treatment is the price of this that you own and buy once, which brings us to the 4th one, for men or women. FDA cleared for men or women, which is known as photobiomodulation. Photo-like biological modulation change. Sound familiar? Photosynthesis, a plant, photobiomodulation for a biological living human being, androgenic alopecia, androhuman, okay? So you can see this very specific color spectrum of light, Adam. These are medical grade lasers, class 3R, no mistake. This is the one that you used to get the kind of results we saw in that before and after.
Barry, we are so grateful. That's such a wonderful explanation, giving us the options, the choices, right? We've still got more to do. If you'd like to start ordering, now's the time to do it, because the final presentation of the day is ending in 10 minutes, and then a new day begins. In fact, let's check in with the amazing, one of the loveliest ladies you'll ever meet. The gorgeous Lynn Murphy joins us. Lynn, looking fabulous. I love the jewelry as well.
This is going to be such an exciting night, Adam, and everyone. I can't wait to share with you. It's been one of the most talked about, iconic, most popular now, fabulous fancy links, and it's called the paperclip link. Well, tonight at midnight, very first time, we are offering it in precious metal, all Italian made, as a today's special. Wait till you see this one day only opportunity buy. I flipped. I'm so excited. I can barely wait. Okay, here's the thing. We have done this link, the paperclip link, in our Bianco, our beautiful, our Italian silver Milano line. One other time in sterling. Not this size, it was smaller. Nowhere near the price I'm gonna share with you come midnight. And first time ever featuring it in sterling with yellow gold and sterling with rose gold. And then we're gonna have all the matching pieces. So I'll see everyone at the top of the hour. I can't wait to share the excitement with you. Thank you, Adam.
And just a few minutes away until Lynn arrives with that fabulous new Today's Special. We can see obviously a lot of folks starting to jump on in an order, and I'm excited for you, like I was excited to try it. We're getting a lot of questions. Barry, who can wear this cap? Who is able to wear it and get results from it?
Okay, so FDA cleared for men or women. So for starters, men or women. Secondly, what we're doing is treating the follicle. That's important to say because I don't want to mislead anyone. If you are shiny bald, in other words, your follicles are long gone, this is not for you. It's not going to create a follicle that isn't already there. However, if you look at this Ledwood-Savin classification, you can see the typical pattern that most women face is their part just gets wider and wider. But notice how we highlighted those gray areas, because you know, if that's one of you, you can see yourself at home in one of those spots, you know there's thin, fine hair there. We can treat that that and bring it back. Gentlemen, same type of thing. If you're receding, if your vertex is thinning, if you're down there at number 7, I'm afraid you waited too long. There is no answer for you. Your follicles are dead and gone. However, if you do have thin hair there, you can use a medical device with class 3R lasers. These are not LEDs, Adam. That's important to say. These are medical grade lasers used in other medical applications that actually treat that follicle with a very specific color spectrum of light. Again, also, no mistake, this is red. That's called 650 nanometers of light, a very specific color spectrum that our hair and skin allow to pass through. So as you see that Fitzpatrick chart, you can see that this light is going to pass right through your skin. Follicle animation one more time and it'll all make sense. Basically, this color light that our skin allows to pass into it is going to go down to that dying follicle that's getting smaller and smaller and smaller. That's called miniaturization. We're going to take those dying cells in that follicle, treat it with light, again, very similar to photosynthesis in a plant, very much like photosynthesis, photobiomodulation is what this is called. We're stimulating those cells, bringing them back to life. That follicle regrows, so that hair regrows. So as you saw in those before and after, someone like Daniel comes in and we can see his scalp. Now all of a sudden, 6 months later, it looks like he's just regrown new hair when that actually isn't the case. We're taking tiny, fine baby hairs with tiny, fine baby follicles, medically making the follicle bigger, back to health, so the hair gets bigger and back to health. That's exactly what's happening. So you can see, I mean, Adam, come on. First of all, Adam, you look great, but really, in this before and after, you can see what's happening on top of your head. And this is what can happen on top of folks' head at home. I want to point out, you see that 6 months there? Yep. I want to point that out because I think it's so amazing, because the doctors that I work with don't tell their patients, go try it for 6 months and bring it back if you don't like it. Now, we know it's going to work, but that is a great safety net, because you can say, okay, he says it's FDA cleared. The FDA says this technology is real. I still have my doubts. Well, after all the medical science, I think it's amazing that HSN is giving the folks to literally turn their lives around to see these kind of results at home for themselves.
You can fight back. You really can fight back. I'm living proof of it, right? You can fight back. You can absolutely help to restore that thinning hair, to help prevent further progression. The before and afters are real. I'd love our team to set up the video by Dr. Dines from QVC. She's world famous, world renowned. She has some insightful things that I do think you should hear. There's so much to this because it really does work, and it can work for you.
My name is Dr. Adrienne Dines. I'm a medical doctor. I also have a PhD. 2 years ago, I began to see a profound change in the quality of my hair. I have started to use Capillus, and I find it effective. It is very important for me that Capillus is FDA cleared. You put it on your head, you turn it on, one button, and you're done.
I know that's a very familiar face to so many of you watching. She's so proud to support it, as am I. Just to reiterate, in our final 3 minutes now, this is the final presentation of the day, down from $2,000 to $1,549. FlexPay makes it easier to afford. It's the best way to pay at just over $309, free shipping and handling. And remember the exception. If you order this from us tonight, we are extending the return policy from 30 days to 6 months. So you've really got a chance to see this work for you. And if you don't love it, you can return it. I think there's a sense of excitement, Barry, for anybody watching who's curious about it. And I'm always excited that you're able to bring the science to this and really showcase that in a world full of gimmicks and fads, this technology has been refined to the point where it is proven to work.
Yeah, and that's what that FDA clearance means, and the clinical trials, hundreds and thousands. But it's interesting, Adam, you talk about the science, because you and I just talked about this a little earlier, and I love talking about the science, but at the end of the day, I can't ignore the emotion that goes with hair loss. I've sat with you, I've cried with you, I really get it. This is huge to me. This is my passion. This is why I care so much to educate you on the science. Yes, but it's so important that you know one simple sentence, and this is the type of thing that I would explain right before I did all the education I just shared with you, and that is a